Hello, risk adjustment rangers, or should I say, rainmakers. You know what time of year it is. It's when CFOs are scrutinizing budgets, wanting to know if you really do have enough money to cover all those programs you put in for 2024. But never fear, my Medicare Advantage friends. I'm going to show you how to show them the money by reading the CMS Risk Score Run. This is CMS's Risk Score Run memo. It's published annually, and while it may include future submissions and sweep periods, best practice is to check it annually to ensure that nothing has changed. Now, scrolling through the memo, want to call your attention to the timestamp for those submissions. It is 8 p.m. Eastern Time. These deadlines, including the aforementioned 8 p.m. timestamp, are specific to health plans. Risk-bearing provider groups are going to want to check with their health plan payer partners as to what your specific deadlines are. Some health plans may require you to submit data as early as 8 weeks before the deadlines listed here, but know the premise for what to submit and how it will impact your payment are the same, so be sure to follow along till the end. Now, there are 3 sweeps periods that we follow in Medicare Advantage: January, March, and September. And if you're saying, now wait a second, but that first line says July, you'd be right to call it out. In the past, there was always a January, March, and September sweep. But during the public health emergency, CMS, in their infinite wisdom, knew it would be difficult to make sure all the data was completely collected and submitted, especially because people were remote and patients weren't going to see their physician with the same frequency. CMS actually retitled the January sweep to be called interim final, and they added this new final sweep period that occurred in the July-August timeframe. It gave everyone 6 more months to submit their data. This period that we just had on July 31st was the last of its kind now that the public health emergency has ended. And so we are now back to 3 submission periods. It's important to understand what's included in these sweeps periods, and it may seem counterintuitive, but September is known as the initial sweep. January is the final sweep, and March is the mid-year sweep. Knowing that this first line was a special period, I'm going to now skip down to the second line, 2024 initial. On September 1st, you submitted data that covered the last 6 months of 2022 and the first 6 months of 2023. You will receive payment in January 2024 for those submissions. Best practice is to make sure that all the data gets submitted, but it is always such a difficult task, especially when claims were not processed timely, encounter data was missed, or you're waiting to connect supplemental data with a retrospective chart review with an initial encounter. But to the extent that your data can be complete it. This is important because while you may have another opportunity to submit your risk data, September sweep is the initial sweep, meaning it sets your January payment. That means CMS is going to reimburse you more per patient in the beginning of the year because you were able to demonstrate the burden of illness on your patient member. You will have more cash on hand and can better control the cash flow needed to fund your operations necessary to care for these patients and members. The next sweep is January sweep or final run. It will always cover a full date of service year. And I want to call your attention to notice it's the 2023 final run taking place in January of 2024 for the dates of service of 2022. It's pretty common for people in the industry to get confused on what year is submitted and when, so it's always important to consult this grid to know exactly what you're submitting and when you need to do it by. Does that mean that you don't submit other dates of service, 2023 and so on? No, absolutely not. Just know that the payment that you're expected to get will only include those 2022 dates of service years. And I know that this says TBD. That is a new additive too, thanks to the public health emergency. But again, these payments usually come around June or July. I don't know why there's still TBD on this memo. I'm hoping they'll fill in the date, but I can tell you from many years of experience, we usually receive these payments around June or July. The third sweep period is the mid-year sweep. That occurs in March. It too has the ability to reset your payments at the middle of the year. And while that payment is also listed as TBD, I found it disperses around July of the submission year. So on this last line, we now have our final line of 2024. Again, dates of service are 2023. Now, while your last day to submit those dates of service is January 31st, 2025, you won't want to wait that long. Hopefully, you will have submitted everything well before this date, because if you wait until this final date, any true up, including monies you were due to be reimbursed, would be pushed off until mid-year 2025. This can be problematic if you're trying to run programs or offset medical expense. The key is to keep your expenses and your reimbursement revenue as close in time as possible so that they offset one another. And to the extent possible, you provide interventions that disrupt the typical disease trajectory by improving health outcomes through said interventions. Again, the best practice is to submit timely and to stay up to date. I know the CMS Encounter Submission Manual has guidance that your membership dictates how often you submit, but I recommend submitting at least monthly, including risk-bearing provider groups. In my 23 years working for both health plans and risk-bearing provider groups, I have never had anyone tell me stop submitting. My experience has always been they're happy to receive the data. The sooner you submit, the more accurate and complete your encounter data, the sooner you'll have reimbursement. It's all about revenue integrity. You won't have huge swings in your finances, and you can adequately forecast and experience reimbursement to fund those programs intended to improve health outcomes. And just some takeaways: despite the deadlines, submit, submit, submit. While you can't have an expectation that data submitted after the deadlines will be reimbursed in that model run, I have known a time where CMS kept the door open and we could submit after the stated deadline. I cannot stress this enough for our risk-bearing provider groups. Submit often and early. Reconcile with your CMS return files. And if you're a risk-bearing provider group, the plans are legislated to give you this data. Ask for the MAO04. It's a good start to know what's been accepted, but know the files can be difficult to interpret, so it's good to find an experienced risk adjustment data analyst that can help you with the interpretation. Perform that reconciliation on a monthly basis to ensure you have enough time to cure any problems with data acceptance well before the stated deadlines. In a future episode, I'll talk more about encounters, but know, per Chapter 3 of the Encounter Data Processing Manual, pay status doesn't matter. So be sure you're submitting all paid, denied, and $0 claims on your 837 encounter file. This is also true for those participating in ACO REACH, though the payment cycle and the risk score compilation is slightly different than Medicare Advantage. That's it for now. Here's hoping your November reimbursements were everything you thought they were going to be and then some.